Hi, my name is Dr. Trevor Lindgren at Copper Mountain Dental in Herriman, Utah. I wanted to talk to you today about the differences between crowns and veneers. Now, crowns and veneers are very similar. They both use porcelain to cover the surface of the tooth. Oftentimes when someone hears the word veneer, they associate it with doing beautiful front teeth that look amazing to change the way your smile appears and do what's called a smile makeover, where you change the shape and the look of your teeth and the color of your teeth. Typically to make them lighter in color. And so a veneer can be used as a conservative way to cover the front side of your teeth with porcelain or composite to change the appearance or shape of your front teeth. And so crowns can be used in a similar way, and there are certain advantages to crowns over veneers. I'll go over those differences in a second. So a veneer typically only covers the front side of the tooth, and they might prep a little bit between the teeth, so the veneer might cover the front side of the tooth and a little bit between the teeth, but not the back side of the tooth. And also veneer type porcelains are usually a little bit less strong than what's used for crowns. It's a weaker type of porcelain that's typically used. So the downside about veneers is they're more likely to fracture than a crown would be because they're only covering the front side of the tooth, and they typically have to be used with the weaker type of porcelains or composite. The nice thing about veneers is that they're less aggressive. You don't have to drill down as much of your teeth to do veneers, but the major downside is the veneer is more likely to break or have problems or get tooth decay in the future. If you have a high decay rate where you get lots of cavities, then doing a crown is a much better choice because the crown covers the entire tooth surface down to the gum line, making the tooth more resistant to decay in the future because there's no exposed tooth surface above the gum line. And so that makes the tooth, the crown much stronger and resistant to tooth decay than a veneer, and it looks virtually the same. Crowns can look just as good as veneers. They can be used, you can use stronger porcelains with crowns that look great as well. And so the nice thing about crowns is they're stronger and they typically last longer because they're stronger and they're more resistant to tooth decay. Veneers I see break and I see tooth decay more often because they're only covering part of the tooth. And so the only advantage of a veneer over a crown is it's more conservative in terms of not having to drill on your teeth as much when you place the veneers. But even with veneers, you have to do some drilling. And so in a lot of cases, I prefer to do crowns when the person has a higher decay rate or they want to make significant changes to the shape or positioning of their teeth, in which case they'd have to do a lot of drilling on their teeth to do veneers anyway. And so veneers can look great, and I like veneers too, and they can work very well in the right case. And so it has to be with someone who has a low decay rate, who doesn't need to change the shape or positioning of their teeth that much, and someone who is really concerned about drilling on their teeth. And so crowns can work very well because they're longer lasting because of the strength and the decay resistance of doing crowns, and they look virtually the same. So crowns and veneers can both look excellent, and it is an excellent way to do a cosmetic case where you want to change the shape or the appearance of your teeth. And I love doing this for people who have had large fillings or large cavities in their teeth in the past. Doing nice, beautiful cosmetic crowns on their front teeth looks amazing. It's amazing to see the difference or the transition between the old teeth and the new teeth. It's an amazing difference that you can notice immediately when we place the new crowns, and you can make them instantly straight. It's almost like doing braces immediately because you can straighten your teeth depending on how crooked they are. If they're super overlapped and very crowded, then sometimes you can't do crowns to correct crowding. But in some cases where you have minor crowding with a little bit of slight overlapping or slight crookedness to your teeth, you can immediately straighten them by doing cosmetic crowns on your front teeth. And so that makes it much faster than going through orthodontics. And for people who have perfect teeth, who have never had a cavity, and they might have a little bit of crowding or slightly crooked teeth, in those type of cases, I typically recommend that they go to see an orthodontist to have their teeth straightened with traditional braces or Invisalign style treatment. But in cases where you've had large fillings and large decay and your teeth would really benefit from having crowns covering them anyway, it's nice when we can do cosmetic crowns for those type of people who have had old crowns in the past or old veneers that are failing or old large composite fillings on the front teeth that are getting stained or worn out or getting new decay in those teeth. In those type of cases, cosmetic crowns make much more sense than veneers, and they look just as great. Like I said, crowns and veneers can look virtually the same. It just depends on the terminology, as if you're prepping or covering the whole tooth versus just covering the front side of the teeth. And in those people who have high decay rate and prone to getting cavities or already have large fillings in the teeth, then crowns are a much better option. So I really like doing cosmetic cases. I've done quite a few over the years, and I enjoy seeing the huge difference it makes in the lives of the patients I help. And the patients who I've done cosmetic crown cases with, they love coming back, and they love me because they're excited about the difference it's made in their life, and they get lots of comments from their friends and coworkers and family about how great their teeth look and how good they work as well. And the nice thing about crowns is they hold up much better over time compared to veneers. But again, in the right person, veneers can work great. And people who just maybe want to lengthen their teeth slightly and they have no cavities, or they have lots of spaces between their teeth, then doing veneers can also be a great option. So if you are interested in doing a cosmetic smile makeover, give us a call at Copper Mountain Dental. I'd love to help you improve your smile and do what would make you happy and improve your smile, if that's something you're interested in doing. I'm not a pushy salesman type of dentist, so if it's something you're not interested in, I don't like pushing that on people. But there are some people who are really excited about changing the appearance of their smile, and doing cosmetic crowns or veneers is an excellent way to do that. And you can do it quickly and straighten the teeth almost instantly within a few weeks after doing the crowns prep, so we can have the new crowns delivered, and so it's much faster than doing orthodontics in cases like that. But again, in people who don't have any cavities, who have decent shaped teeth, in most of those cases I recommend that they get orthodontics done and see an orthodontist. So I don't blanket recommend doing cosmetic crowns for everyone, but for the right cases and the right people, it makes a lot of sense and it works great. And they hold up really well over time and they look amazing. So give us a call. I'd be happy to help you do a cosmetic smile makeover and improve the appearance of your smile. And I had a lot of experience doing that over the years. And I'll post some before and after pictures of some cases I've done on our Google page, and as well as on our website. So thanks so much for watching. I hope you have a wonderful evening. Talk to you later. Thank you.